Hello, 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 friends. Happy Sunday and happy June. Oh my, the days are just flying by. Welcome to Power Time. And I'm your hostess, Sharon Herbert. I'm Coach Sharon, of course, coming to you live from Power in Nursing Innovations. So thank you so much for taking some of your precious time out today to share a little with me related to nursing. You know, nursing is my thing, and it has been since I was 5 years old. I wanted to be a registered nurse, and yes, I did it, and I can never let go. So, we're here again to talk about what's going on in the world of nursing, in the world of health and wellness, in the world of healthcare, or I might call it anti-healthcare because things are just going a little wacko. Well, probably more than a little. Somehow we survived. We survived the COVID pandemic, but still we suffer. Still we suffer. Still the less fortunate people of the world suffer from not being able to stay well or even be well. It's such a challenge, and you can throw out any number of golf balls or whatever you want to call them to not be able to get the ball into the hole to say, yes, I got it, and we'll be fine. Well, I'm so honored today to be here with you in the heart of healthcare. Our nurses are the heart and soul, the backbone. Many of us know that word about nursing. And while today's world brings change, disruption, and I'd even say corruption, and uncertainty to healthcare organizations, systems, guidelines, one truth remains. One truth remains that nurses are and will be the backbone of healthcare and healing. So let's spend a little time considering how we can understand where we are today and where nursing and nurses can be in the future. You have your new grads who are just coming to their first new nursing jobs as licensed health professionals, and they've passed their NCLEX. They're fired up and ready to go. But remember your own time when it was you. I remember taking that test, and I remember not taking it in one day. You had to take part one, and then you'd go home or wherever you were staying for the evening and come back the next day for part two. And so that could be a stressor, and that could make you anxious. But remember, we're here together. And remember, together we rise. And that's the title of today's message. Together we rise. And don't ever forget that you are not alone. You are not alone in the sphere of healthcare. Wherever you are, wherever you're serving, there's someone else who has been on the road and on the journey that you are on now. So you're not alone. You can ask questions. You can do the homework, as I would say to my orientees. Do the homework, do the research, ask the questions, and we'll move forward together. So that's our message before we get too tied up in how much we have to ask. But remember, together, together we rise. And so the flight from student to licensed professional can be a bumpy road. It can be a challenging journey, but it changes as we all go along. It's changed a lot since I got my license, and I will say, back in the last century, not decade, yes, the last century. It's been more than 30 years for me to have obtained my professional license and become a registered nurse. So today, we are seeing so many challenges that some we of my age never knew about. And so it was a crapshoot for many of us. But remember the changes of today from yesterday. We didn't have a lot of digital data processing resources. So we had to do what? Ask questions and look it up in a book. Okay, so here we are today. And things have changed. As the pace has moved forward, there are still a great number of persons in the world who need care and service. And it does appear, I'll just say appears, that those persons are being served when they are sick, and not so often when they are well. And today, we've seen hospitals close. We've seen CEOs resign. I know once, not too long ago, it was in the last month or so, that there was a CEO that I've heard of, and that person started a new position in a hospital CEO and left within a month, left that practice, that organization within a month. But nurses remain still at the front lines. And even though services are cut down in some organizations, if you don't know me yet, do know that I'm always reading something. So today I read about a hospital that's closing. They opened in 2014 and they were doing some med surge procedures, and some could have been outpatient, some just a brief overnight, and they're closing because they don't have enough patients in that area. But they built a whole hospital for this particular demographic site and area, but then within 4 months now, 4 months, 5 months now, they don't have enough patients, so they don't have enough income to employ staff and to make sure that all of the resources necessary for the care and service could be obtained. If they didn't have enough money, this is now about finances. So the funds are shrinking, and now they don't have clients who have funding sources like insurance, like many folks rely on. So what happens? The C-suite now must come to grips with what the numbers look like, whether they're the numbers of the funding sources or the numbers to pay the employees or keep the lights on. Remember, amid all of the losses and questions about how long this can go on, nurses remain. Nurses remain on site. not just delivering care, but holding the systems together. Nurses will work longer hours, nurses will work more days, weekends, nights, holidays. Nurses are there to care for the needs of the patients. But of course, they must be paid as well. So, what happens when the challenges that are now flowing up to the C-suite really become the numbers that don't allow the head honchos in the organization to continue to support the care and services financially? The nurses will be questioning what's happening, why is it happening, how long it's going to happen, and why it will affect me. Because your time is money, isn't it? Your time back in that day that I was talking about, the NCLEX, your time is money. And the changes that are most often related to resources and finances affect more than jobs. More than jobs. Because what types of patients can they serve? If we're talking about the med-surg component that now is going to have to be cut down because of the resources necessary for those services, well, the financiers have decided, along with the rest of the board, that they don't have enough money to serve those med-surg patients who are necessarily needing resources that cost more than sleep studies or mental health resources. Well, you throw up the two balls, which one is going to be cut? But let's be clear. Nurses are here at the organizations available. But a nurse is not a nurse, is not a nurse. Remember, we are all different. We all have different areas of specialty and expertise. So you just can't change the nurse in the med-surg unit to one in the mental health services places and or the sleep studies. They're all different. So we must remember that we are not powerless. You would not be the person who will be comfortable in jumping from unit to unit, from floor to floor, and especially if some of the patients require intensive care services, you can't go from the sleep lab to the ICU on a float day. I'll have you look that up. You'll find out the why. So, how do the nurse professionals continue to serve as the patient's needs arise? Because there are skills, but there's also thinking that is required. You can't just tell your patient that they will be going to the OR and or discharged tomorrow and then say goodbye. That's not how it's done, and that you know. We must understand the needs on the front side for the patients. They don't know all of what you know about the service that they will require to take care of their needs. And they won't know what the services may be when they are discharged and they are going home. When they live all alone and they're 69 years old and they have 12 steps to climb from their front door to their bedroom and they've had a hip replacement. How is that person going to manage best care at home if there's no one to help them with the instruction? So all of that comes with closing that med surge unit down, because now you don't have persons to deliver the instructions and support the responses to the questions that the patients may ask. So together, we have to look at the environment. And yes, we will honor what we hear from our leaders and our executives, but we must ask the questions. What happens now? Why do nurses need to know? Nurses are more than caregivers. We do more than change a dressing or a Band-Aid. We are problem solvers. How will we divide the stresses so that they don't flow and interfere with each and every nurse on our unit? That's what together means. Together we must rise. We must help those persons who are in our care. We can't just say, well, you're finished, goodbye. That will not be the road to best outcomes for the patients or for the organizations. We can't wait. We can't wait for someone else to fix the challenges with the systems. We must take our place at the table, at the tables of the leaders. Innovation and influence is important. If we don't have enough supplies, how will we take care of the patient, even if the patient did, by chance, have drawn the straw that says, yes, you are the patient who will have their surgery today, and bless you because you are the last one. We've got to help the organization understand what the processes are from when those patients are admitted until the time of discharge. Who we are, what we do, how we do it, and how changes may need to be made based on the status of that patient. We must speak up. We can't be silent. We cannot be silent. Silence in chaos does not serve us well. It does not serve the staff. It does not serve the patient. It does not serve the organization or the community. If none of us know what's going on, and no one will give clear messages or presentations about where we are and what's happening here. Whether you're at the bedside, in education, in administration, or in another role that may lead to transition, maybe you're in that sleep medicine lab. You have to speak up. Your voice matters. Your voice absolutely matters. And we must speak on each of these issues together. There is not only one person that recognizes the challenge and doesn't want to speak because they're afraid to get in trouble, or they're not sure if they really have the answer. Well, there are ways for us to continue to work together to solve some of the problems. Now remember that we are greatest problem solvers. And you know that if you have passed that NCLEX, that you have won the prize for a greatest problem solver. So let's join forces to solve these problems. Remember, together we rise. We can create networks, we can create teams, share resources, and offer support. Maybe you are the best IV starter on your unit, and your colleague is overwhelmed because things have changed in her schedule, and now she needs help. Help each other. Connection is so important because there is not only one person that can help save the day. Connection. And what about empowerment? You know, that's one of my favorite words. You know that you can shine. You can shine. Investing in personal and professional growth is really important, and it helps you to help some of your colleagues as well. And leaders might ignore your thoughts until they need to know what the policy is about mandatory overtime. You help each other. And how to create discharge planning wellness strategies for those persons who are diabetic. You need to know and trust in yourself and your power and your plan. Work together to share that powerful information. It will help all of you. And advocacy. Now, what about advocacy? Because as we're talking about the med-surg unit closing, and then there's those last patients who are anxious, but they're kind of happy because they're at least going to get their procedure done. Be advocates. We know how to do that. Be advocates for your patients, for yourselves, for your colleagues, for your unit. If you are on that med-surg unit and that med-surg unit is closing, speak up. Push for staffing reform. Be a part of the policy conversations, because maybe there is only one chief nursing officer in the C-suite, but that officer hasn't spent time in your unit. Give them a hand by helping them be able to share your concerns. And that will bring the light to your conversations and your challenges. Speak up. Speak up. You must. And remember, we do not just sit back, let things happen, and say, well, someone's going to fix it. Because you are the someone. You are the someone who knows the ups and downs of the patients on your unit, You're the someone who knows how and when you get resources delivered to your unit, because it's going to be pretty difficult to have a med-surg unit without any gauze and any tape. Oh, no saline? Wow. And no one has said a word? Remember, you cannot hide. You cannot and you must not. We need a new direction with nurses who shape the future of care for the patients and for us, for each other. We are making our voices heard. We are empowering ourselves, our clients, our leaders, to speak to what the change is that's necessary for our unit. And if we are not getting patients, what is the challenge for the organization? It may be something they have not considered. So remember, you cannot just sit back and let those things happen. Look at it from your perspective and from the perspective of your unit leaders and even your new grads. Imagine the future of nursing. Imagine a profession where nurses are fully supported. We are paid equitably. That means fairly. You are respected universally. And that is still one of our biggest challenges as we are on the picket line for money and time. Remember, respect and your worth are important. You can't pay me $1 million of dollars and then tell me I'm worthless or I'm dumb. Oh, no, we won't step there because we will soon be on the line. Respect is important. And growing and leading in the organization on the units, we can't just have, and especially in a med-surg unit, one supervisor and 2 unit techs and 1 RN. Now, you and I know that, but we must be able to facilitate and review the role of the nurses on our units and make decisions. That shouldn't just come from the CEO. We know what we do. We know who we serve, how long it takes to get a person that's had a knee replacement or hip replacement taught the discharge instructions and be prepared and be discharged. It doesn't happen in 5 minutes, and it doesn't happen in one shift. So you need to know about where you're sitting now and what the future will look like if you say nothing. And as the future is coming your way, imagine who is coming your way. We know it's June, and yes, so we talk about new grads and schools of nursing. And imagine schools of nursing just exploding with applicants. These days, and even in my former days, as a leader and a director of nursing, there was not a shortage of folks that were applying. It was a shortage of faculty. How can we serve and educate the nurses if there are no spots? How many students can one nurse faculty treat? And Med-Surg, as many of you already know, is its own course. Med-Surg is not a 1 week, let's talk about Med-Surg, okay, you're good to go, and have a nice day. We have to be able to learn and grow. And if a faculty member has 100 students, how is that going to work out for the students and for the faculty? We have to think about where we are, what the future may hold, and how to change the setting to be encouraged to set the stage for the next generation of nurses. We must have enough faculty to teach those persons. And remember, we talked just briefly about the roles on each of every unit and how and if people are allowed or encouraged to take the next step. Professional development is the line, it's the line that you will stand in, stay in, create your thoughts related to what you might be so encouraged to do. Maybe you want to be the pediatric faculty member. Maybe you have a friend who is just thinking of retiring from pediatrics, and she will apply to be one of the adjunct faculty for your class. Well, that may encourage you to be more excited about teaching that Med-Surg. If you have a way that you can break down some of that Med-Surg to include coursework on pediatrics, at least with health assessment, that can help lift some of the weight from the faculty member. And each of us can think about this. The things that can start the future discussions and conversations. Now, we know that we're not all the same. Some are different in specialty, and some are different in level of practice. Nurse practitioners can serve as faculty as well as they have done in many settings. And the community can be well served by being able to ask questions to nurses who have the patience and are encouraged to support and answer the questions that are brought to their attention. Our voices must be heard. We must know how to help each other. Together, we rise. We are the best planners, and we've already said that. Problem solving is our gift, and even if it wasn't your gift when you first came to nursing, you had no choices. The questions you must answer. You don't get to skip along, and you don't get to pass that to the next student or the next faculty member. You must solve the problems. in the creation of the problem, you're probably saying, oh my, more problems? Yes, and they will come. And your goal is to lift the problem to the best outcome. And don't do it alone. You don't have to do it alone. Those are some of the sticky moments that I even experience as a nursing faculty, and yes, for pediatrics. It's a challenge because you've got to keep yourself focused and keenly focused to review what's going on with your students, even if they haven't asked you a question. You can see what's going on. You can see whether two students are huddled together with the task of changing a feeding tubing, changing a feeding pump. Any of those questions, if they're looking at you with wide eyes, ask them, how can you help? How can you help? Together is our answer. Together we can, and together we rise. We care and we share for our patients, our organizations, and our community. Public health is so important. So think to yourself, how can I serve nursing better? And if we have some straight and narrow roads every now and again, because every other now and again, you're going to have a challenge. But come together and think of ways to help each other be the best version of you. Be the best version of you. And together, we can solve most any challenge. Be well, my friends. This is Coach Sharon coming to you from Power in Nursing Innovations. And it is up to nursing to set the future for success and satisfaction for our next group of nursing students who will wave their banner and their license and show you that they're ready. Show you that they're ready. Do it with them and remind them that together we rise. This is Sharon Herbert, Coach Sharon, coming to you live from Power in Nursing Innovations. It is my distinct pleasure to share the afternoon with you. Know that Power in Nursing is here for you. We love you and we want to help and see you grow. And that is the goal. The goal for the future of nursing is growth and a successful future. Let's do those things together. And together we will help the patients, the organization, and the community, as well as the number one server. It's us. Do it together. And together we will grow, and together we will rise. Thank you, ladies and gentlemen, for spending such time with us. And remember, nursing is all about you and your future. We will give those same strategies As you meet those rough roads or those bumps, don't try to solve everything alone. More than many of us have faced the challenges that you're already facing. And we can help you to avoid the pitfalls, overcome your stressors, overcome the overwhelm that can lead you to burnout. Take the time to acknowledge what you're going through and ask for help. We're here to help you at Power in Nursing Innovations. Thank you so very, very much. And remember, you can reach us right away on powerinnursing.com. It's the website, and powerinnursing6@gmail.com. Now, those are two changes that we've updated things in the last several months, but it does look like we are going to make some more changes. So keep aware and alert for the updates. If you have subscribed or contacted us, you'll get emails that will help you find how to find the updates, and you can always call our office. Power in Nursing is here for you. This is Coach Sharon coming to you live from Power in Nursing Innovations. Be well, my friends. Be well.